the next thing, that is the myths about diabetes. There are many myths which keep circulating. And as I said, they're so loud and clear that they almost sound true, but they are actually myths. First thing, we should not eat fruits. A diabetic person should not eat a lot of fruits, and especially not the fruits which are sweet. But what we need to understand is that the sweetness of the fruit is its essence. It is sweet by its own nature. Its virtue is to be sweet. And that sweetness comes from fructose, which has a low glycemic index. And all fruits have fructose. So, cutting out on one and saying that eating the other one because that is sweet does not make any sense. And all these fruits are actually rich sources of minerals, vitamins, fibers, and antioxidants. So if we are staying away from the fruits, we are definitely depriving ourselves from nutrients. Especially, I would like to talk about mango, which when in season is liked by all, but feared as much by each and everyone. But mango is a rich source of fibers, antioxidants, vitamin A, vitamin C, and it has so many phytonutrients. It also has a very bioactive compound, mangiferin, which it has therapeutic benefits. The glycemic load and the glycemic index of mango is also very much consumable by diabetic patients. The glycemic index is 51, which is considered to be a low glycemic index. So we should not be cutting down on mangoes or bananas or custard apples or chicos or any other fruit which is sweet, just for the fact that it is sweet. Cutting down on ghee and fats, we've already spoken about that. The ghee is something which reduces the glycemic index. It helps slow down the gastric emptying. So it is not something which should go off the plate. In fact, good fats help secrete better insulin and stabilize the blood sugar. So it is the good fats which should be kept on the plate. Rice. So worried we are about rice, even though we love rice, but we do not want to eat rice simply because it is a carbohydrate, because it gives a sugar spike, and because it would make us fat. But actually rice is nice because it is one of the good prebiotics, which is promoting the good gut bacteria. It aids digestion. And the way we eat rice with our lentils and vegetables, this combination has a low glycemic load also. Hence, it is not giving us a spike. It is not that we are just piling up rice on our plate and eating. We always eat rice in a combination of dal as in khichdi, or with vegetables as a pulao, and with addition of good fats like ghee. This kind of a dish helps in assimilating your vitamins, your B12, your iron levels, your D3 levels. It even gives us good sleep, promotes good sleep, so fights insomnia. It kinds of reduces stress, fatigue. It lifts up our mood. And what kind of rice is the biggest question that is there? Not the brown rice, which has excess fiber, which cannot be digested. Not the white rice, which is extremely refined, but the single polished hand pounded rice, which is locally found in our areas, which is the kind of rice which the farmers produce and sell in the market. So rice is something which really helps us get good sleep. And then, of course, we wake up better in the morning, and we even want to exercise when we have woken up after a good sleep. So it is rice when we incorporate this kind of food, we make sure that the other things are also happening properly. And it also maintains our energy levels. It helps in the growth of neurotransmitters. It is taking care of the nerve issues also. So we cannot be just, putting off rice. Same thing with cashews. It is so feared that it is loaded with cholesterol. But cashew is a plant food. it has phytosterols, it has zero cholesterol. And yes, it has good fats, it has loads of fats. But as I said earlier, that good also need not be taken in excess. So all we need is a handful of cashews to get the benefits of cashew. All the minerals, all the vitamins, the good fats, the oleic acid, which is heart healthy, in controlled portions. When we are having the cashews, there is nothing wrong going with it. In fact, the antioxidants and the iron assimilation is better, and we can fight the free radicals. And the cell damage is also reduced when we are having cashews. It promotes good sleep again, and it helps to lower blood pressure. So when we are kind of, touching all these things, when we are taking care of all these different aspects, then we are able to manage our sugar levels well. But if we are just treating sugar or the spike in sugar, and we are just thinking of cutting down on sugar and adding things like sugar free or going zero sugar, that really does not help. That 1 teaspoon of sugar in your tea is not the culprit, but the culprit is the artificial sugar that we are adding to it, or the refined biscuits that we are having with it. So this is a thought we all need to understand, and we need to explain it to the diabetic person, that this is how you have to plan your food and get your strength back, help those malnourished cells get nourished, get to nurture them better again, and then get a stronger pancreas, get better insulin production with all these things in mind. Walking is the best exercise that we've already spoken about. That walking helps, but along with that, we need the other parameters of exercise. So that is all that I would like to say today.